I liked Play School. Humpty Dumpty was my favourite. My name's Pam Bayer. I'm a pharmacy technician and support staff facilitator at Guy's and St Thomas's Hospital. Our job role evolves from dispensing medications to manufacturing and procuring medications for the hospital. My job particularly, I'm an assessor, so I train future pharmacy technicians and I train pharmacy assistants to get their qualifications. I wanted to go into teaching and I started work experience at a community pharmacy at the age of 13, which then led to a Saturday job, so that was kept open for me. And the more time I spent in that pharmacy, the more I became interested in it and realised there's so much to learn. Back then there wasn't really pharmacy technicians, there was pharmacy assistants. And then I moved into hospital and realised actually there are pharmacy technicians and actually we can get a qualification whilst we're working, so that was really attractive to me. Because even though I'd gone to university and I wanted to go into teaching, I then realised actually I like pharmacy a bit more. I didn't want to go back to university. A pharmacy technician course actually suited me better, and I was still being able to help patients. I was still doing all the different things that I would have imagined working in hospital pharmacy, so that really attracted me to the post. We've got so many different extended roles, from actually working on the wards, conducting a final check, there's manufacturing and aseptics, and we've got technicians working in procurement as well. So we're actually quite a big team now. There's different roles you can go into, so things have changed over the past few years. So a normal working day for me would be can range from having meetings to dealing with students, assessing them, teaching and training. An abnormal working day for me would be if I wasn't in the office. I'd be here in dispensary like today, so I'd be labelling medications, checking them for patients and helping colleagues. I also work on the wards at the weekend and when they need extra staff, so up there I'll go check medications, speak to the patients and make sure that all the medications are prescribed correctly and work with the pharmacy team and other healthcare professionals. I think in my particular role, where I'm dealing with different kinds of students, they've all come from different areas and walks of life, so it's almost trying to make sure that they understand their roles and that they're adhering to the trust values and behaviours, and eventually they're going to be registered professionals, so that can be quite challenging at times. Values-wise, you need to be patient-focused. I think you need to make sure that's your key thing, that everything that you do is for the patient. You need to act with integrity, be honest, and you need to be a trustworthy person. You need to have good communication skills, good teamwork skills. You need to be diplomatic at times and be flexible. You can go on to manufacturing units, you can go on to being ward-based technicians, you can help with clinical issues with the pharmacist. So the roles are extending, so there's lots of career routes for everyone to take. Get some work experience, understand what your role is going to be as a pharmacy technician. Contact your local chemist or your local hospital, see if they've got a work experience programme, try and get on there, shadow other pharmacy technicians and pharmacy assistants and see what they do. And then after that, if you're still interested and that's what you want to do, is make sure you've got the qualifications to enter. I would like to work for the Lego company, either as a designer or somebody that can bring some education-wise into it. I do try and use Lego when I teach, because I do teach at the colleges, so I try and use Lego as a way of training how drugs work, and it does make it quite exciting and fun way to learn. So yeah, that would be my dream job.